Katherine Kennet. I'm a psychiatry registrar specialised in child and adolescent psychiatry. I'm also doing a psychotherapy training. This is my second video. I've already told you a little bit of an overview of therapies and we've talked about psychotherapy, and in this video we're going to talk about CBT, cognitive behavioural therapy. Now, as I mentioned in the last video, I like to think about therapies on a continuum from the most intense to the least intense. The least intense, I've put counselling. Now, counselling, people often use that term generically to describe therapies, but when we're talking about psychiatry, we use counselling to mean a space for listening. So a patient will come and see you as a counsellor. You're not a therapist, you're not a psychiatrist, you're not a trained therapist, but you're a trained counsellor, which means you're trained in listening. So that's really helpful for lower level complaints, so things like grief, which is really debilitating, but patients who are grieving will often need a space just to think, to talk and to be heard and to think with somebody who's not trying to teach them how to, as with CBT, teach them how to fix how they're feeling and not try to really probe into deep analytical issues as with psychotherapy. So around in the middle of this continuum we have CBT, from intense to not that intense. CBT stands for cognitive behavioural therapy, which means cognitive as in to do with thoughts and thinking, and behaviour to do with actions. CBT is a shorter term therapy than psychotherapy. Now, in psychiatry, when we talk about short term, we mean something quite different to the rest of medicine. By short term with CBT, I mean 10 to 12 weekly sessions. That's around 3 months. So CBT is a weekly session of about an hour with the same therapist who you see every week. CBT is very structured. So I told you in the previous video about psychotherapy, which is very unstructured, what we call explorative. We just explore and go with thoughts. CBT is very structured. So we have goals that are set at the beginning of the course of therapy, and in each session the therapist will go through with the patient some set tasks. So that might be some worksheets identifying spiralling negative thoughts, for example. They might be giving you tips and tricks, as I often say to patients, in how to deal with difficult thoughts, and they'll always give you homework. That's another key word for CBT, to go away and either fill in a sheet or notice your mood every day or try different techniques. The cognitive aspect of CBT and the behavioural aspect refer to the two different strands of psychotherapy. Of CBT. The way we think about CBT in essence is what we call the hot cross bun model, because it looks like a hot cross bun. I don't know if you can see this here, this page from my notes, but essentially you have a situation, this is the CBT model, that would lead to a cognitive response, i.e. I'm not normal, or I want to be somewhere different. That will in turn lead to a physical response. So if you feel that you don't want to be somewhere different, you might start feeling sick, you might get sweaty palms, for example. That might lead to a behaviour, i.e. leaving somewhere if you don't want to be there. And that in turn will lead to a mood, i.e. you might feel anxious if you don't want to be somewhere and you're worried. By identifying the fact that, so you go through with the patient where they are, for example, meeting someone new, what they're thinking, I don't want to be here, or that person thinks I'm silly. You can identify how that affects their body, are you feeling nervous, and what that actually means in terms of feeling sick, feeling shaky, feeling worried, feeling sweaty, for example, how that affects their behaviour, are you wanting to run away, and how that affects their mood, are you feeling anxious, and noticing that all these things affect each other. That can be really helpful for the patient. So what you might do with the patient is break down each of these things in different settings and help them to notice throughout the course of the therapy what's happening and when. Then you might give them some psychoeducation as part of their CBT, where you teach them what happens physically in the body and how that affects thoughts, for example, if you're anxious or if you're very low. And you might offer alternative ways of thinking or distractions to help them manage those anxieties. CBT is very helpful for depression or low mood, and also can be very helpful for anxiety disorders such as OCD, for example, or social anxiety or generalised anxiety disorder. It doesn't necessarily get to the deeper level stuff, so for example early life experiences or trauma, and the way that CBT is used in the NHS is because it's only 10 to 12 sessions long, it's often easier to access than some of the longer term therapies. So we often offer that to patients, see how they get on and see how they do at the end of it. Yeah, that's CBT.